Under the Affordable Care Act, Americans are being required to get some form of health insurance. But for those who run free clinics around the country, the big question is, what role are they going to play in this new health care reform landscape? Well, for scores of Kentuckians who lack health insurance, the free clinic has been a lifeline to vital health and dental care. On the program today, we're going to talk with the executive director of the Commonwealth Health Corporation's free clinic in Bowling Green, and to find out more about what's happening with free clinics and what it means for you. Kentucky Outlook is next. Hello and welcome to this week's edition of Kentucky Outlook. I'm Barbara Deeb. You know, as the Affordable Care Act unfolds, a lot of us are watching with interest, and many of those in search of health care, from clients to providers, are feeling their way as we go. In particular, the working uninsured, who for years have relied on the services provided by what is known as a free clinic. Now, for residents of South Central Kentucky since 1996, the Commonwealth Health Corporation has provided free basic medical, diagnostic, and treatment services to the working uninsured in the area. Now, those numbers are staggering. They really are, because over 100,000 patient encounters have happened since those free clinics opened, and that amounts to about $40 million in health insurance or health coverage. The working uninsured. On the program today, we're welcoming Carla Reagan, who is the executive director of the Commonwealth Health Corporation's free clinic. Carla, thanks for being here. There's also a dental clinic, we should point out.
Our free clinic encompasses two programs. We have our medical program and our dental program. Both were started when we opened the clinic. Actually, we opened in December of 1995 to provide services in both those areas to the working poor, as they were referred to at that time. We have chosen working uninsured.
Let's talk a little bit before we go any further, because, right, if you're familiar with that term, the working poor, which has always kind of put a little question mark at the end, and now in a more kinder, gentler way, we're calling them the working uninsured. So who are those people?
You know, they're people that every one of us see multiple times every day. They're people who are working, they're trying to do their best to provide for their families, to put food on the table, to pay the electric bill as the weather gets colder, and to take care of their family's health care needs. And sometimes there's just not enough money to do all. When the free clinic was established through a process where there was a committee put together after the medical center at Bowling Green back in 1980 was opened and doing well, the president and CEO of the company, John Demery, at that time wanted to know, was there more that Commonwealth Health Corporation could do in the area of health care for our community? The hospital was doing everything it was supposed to, but were there things outside of normal hospital activities that maybe we could help with? And so a committee of volunteers and hospital administrators spent some time, some months, and they came back and they said, you know what, there's this group of people out there, the working poor. There are people who are doing everything right. Somebody in the family's working to support, but when it comes to having health care insurance, it's just not there. Either the employer doesn't offer it, so it's not available, or if the employer offered it, the expense was too much for that person to feel like that was something they could afford, and so people did without. And then when basic health care concerns came along, you were really stuck because you couldn't pay out of pocket to go to see a doctor. So those were the working poor, people doing everything right, just not in a position where health care insurance was something that was affordable for them to have.
Well, I want to talk more about the free clinic, what it offers, and the hospitality house. But so right now we're in a new sort of landscape, in a new environment. Well, in the intro I said we're finding our way. Really, everybody's just kind of looking and saying, under Obamacare and Affordable Care, what do we expect, what do we do? So I know at a free clinic you're certainly asking those questions.
We are getting a lot more frequent asks, not only from our patients, but from employees, from donors. Because, you know, on the surface, when you just kind of hear what the Affordable Care Act, Obamacare, whatever you call it, is going to do, it sounds like everybody's going to have insurance one of these days. And since we see those who don't have insurance, you know, will there really be a need for free clinics? I attended a conference not too awful long ago, and at that conference, a lady by the name of Nicole Busby, who is the president of the National Association of Free and Charitable Clinics, spoke, and she was addressing the answer to that question. And she just said, we fully believe that maybe even more than ever, free clinics are going to be needed. As great as the Affordable Care Act sounds on the surface, there are going to be people both in Kentucky and nationally. They estimate in Kentucky 250,000 Americans will still be uninsured after full implementation, whatever that means. And so we feel like the free clinics are going to be poised to still be a part of that care giving structure to those people that will still be left behind after full implementation, again, whatever that means.
Well, exactly. We're still waiting to see what full implementation means. But what we understand it to mean is that if people cannot get health insurance, they're going to have to pay a penalty, and it'll be phased in over the years. So you're saying that those would be the people that, the working uninsured, they'd rather pay the penalty because they can't afford to pay for the insurance.
I think that's one subset of those people that will be in that estimated 250,000. Those people who choose, I mean, the first year the penalty is $95, and for a lot of people it's much more affordable to pay that penalty than to pay the cost of an insurance policy. Now that's going to go up as we understand over time, and that may change their thinking. But there's also people that are going to be exempt from the ACA, maybe for religious beliefs or other reasons. And then there are going to be those people that can't afford it, even if there is a penalty, or if the cost of that insurance is going to, I think it's more than 8% of their income, they're also going to be exempt. So there's going to be a lot of people that are going to be in a subset of people that aren't going to be covered, even if ACA does its job as we hope it will.
So as it stands, the Commonwealth Health Corporation's free clinic is really taking that attitude, like so many in the nation, just kind of a wait and see and do what you're supposed to do as you go, but we'll continue to provide services.
Absolutely. We don't see our role going away. Now we do see that there may be opportunity for us to adapt or to change maybe the criteria of what we become. We just don't know who's going to be left behind yet, and when we do, hopefully we'll be in a position, I know CHC would like to be in a position through the free clinic to still fill some of those gaps, whatever they might be.
To be that stopgap,
Absolutely.
To be the person that's there. So let's take a closer look at the Commonwealth Health Corporation's free clinic.
Sure.
I know we have a photograph, we're going to put that up, and people who live in the Bowling Green area have probably passed it on numerous occasions and maybe wondered what it is, or maybe if you're watching this program, maybe you've been able to use the services that are offered by the free clinic. So to be eligible, you're watching this program and you say, well, I'm working, I don't have insurance, maybe I could use some of the services that are offered there. So how does it all begin?
I would love to tell you about it. Now, we have two programs, as I mentioned, medical and dental, and while both of them used to have exactly the same guidelines, as things develop as they do, we've kind of got two different programs now with some different criteria for both. And I'm going to talk about our medical program first. That hasn't changed. We provide basic medical services, and by basic, we're looking at acute care conditions like coughs and colds, and somebody has a bug bite or a rash that they need a doctor to look at. Quick upcoming things that they need to have checked out. We also do basic chronic care, which basic chronic care is kind of maybe not a great term, but people who have blood pressure problems or diabetes or they have arthritis, they need medications month by month to maintain their diabetes or their disease state.
Right.
So those are kind of the two things we provide in our medical clinic. The criteria for our medical clinic is we do have the working uninsured is our criteria there. So either the patient or a patient's spouse, as long as they are employed. And we do such a good job, I think, trying to get people in, not keeping them out. So, we have people that babysit, or they're paid on a weekly basis in cash for mowing lawns. It doesn't mean you have to go to work and get a paycheck to show us. If you are employed, if you're working to support your family, usually we can take that information and make that work to make you eligible for the services we provide. And then everything is free. The doctor visits are free. The medications that we provide before that patient leaves are free. There are often even times that the doctors, who are all volunteers, bless their souls, our volunteer doctors say, this patient needs something more than we can provide in this basic care environment. And depending on budget and where we are in the year, many times we have the ability financially to send that patient on through our healthcare system at the medical center through CHC, and sometimes we can provide advanced diagnostics or sometimes some surgeries or additional tests or wound care or whatever it happens to be, bigger labs than we can do in our lab at the free clinic. So we send that and send those patients, and it's no cost to the patient to do that. So that's kind of our medical program in a nutshell.
Well, and let's take a closer look at that. So they come in, they find out if they're eligible, and then they can take advantage. I don't like to use the word take advantage. They can use these wonderful resources that are available to them. But there's a bigger picture. How is it that you're funded through the free clinic?
Okay, we have funding from a couple of different places. First and foremost, Commonwealth Health Corporation, as our parent company, provides all of our operational costs. So each year, my budget includes what I need to pay the light bill and to be sure that our licensures are paid up and that my employees at the clinic are paid, the ones that we have. So they take care of the operational needs, and then we have just awesome donors. People who support us in so many ways. We have companies who support us through things like our gala that we just had this year, or we have individuals who want to make contributions or donations. And the great thing about the donations at the free clinic, and I know it's rather unique, is that 100% of everything that is donated to the clinic is put into a special part of our budget that is only used for patient care. So never does anybody pay for a salary or a light bill. 100% of their donation goes to support the services provided to those patients that come into our clinic.
And then you mentioned the volunteers. So when you go to the Commonwealth Health Corporation's free clinic, or I suspect free clinics throughout the country, it is a volunteer base of doctors and medical personnel who just out of the kindness and goodness of their souls give back?
That's exactly right. And we have doctors and nurse practitioners with us right now who have been with us all 17 years we've been in operation, and some new folks coming on. My biggest dream to be realized is to wake up one day and have 50 people, doctors and nurse practitioners at my door wanting to help. It would be awesome to have so many that people just came a couple of times a year to help. But guys and gals that come and do such an amazing job for us after sometimes being in the office all day themselves, come in for a couple hours at the clinic and just do an amazing job, sometimes outside of their specialty, working with our patients and making sure that they have what they need.
Now you mentioned having a small staff, a paid staff at the free clinic, but then you also rely on volunteers to help check in patients and do those kinds of things?
We have a big need for clinical volunteers, people with license, nurses and doctors, but we also have a place for non-clinical volunteers to help us do the screenings. You know, when I mentioned eligibility for the free clinic, and we just talked about eligibility based on working, there are a couple of other things we check. Obviously, there are financial limits to what you can make as a family. We operate off of the National Poverty Guideline that is set each year, and our patients can make up to 185% of that. So they can make up to almost double of what somebody that is considered at poverty level can make. So we have people that are checking what the family income is, make sure they fall within that guideline, and I think it's about $45,000 for a family of four. So we're not talking about totally destitute. We're talking about people who have jobs
who are really
that are making,
trying.
trying and doing a good job. And they also check to be sure we have a coverage area. We cover the Barren River area development, so 10 counties, Warren, and 9 counties surrounding us. So those people are able to help us screen those patients and then move them on to the next station where they see a nurse and we get vitals and figure out why they're there, and then they see the doctor, and then they see the pharmacist, and then they're on their way, usually all within about an hour and a half's time.
And so these people, recurring patients, well, like you said, those that maybe have a chronic illness have to continue to come.
Yeah, I think maybe at the beginning, the free clinic was always kind of seen as something that would be a temporary measure, and it is for many. They find themselves, sometimes people find themselves just one life crisis away from being in a situation where you need help, a job loss or a major illness. And some of those people travel through our clinic and they find themselves in a better place one day, and they're gone. They're out of our system. We have patients that have been coming to the free clinic for all 17 years we've been open. We are their primary care physician. We are their medical home. So we have a little bit of both there.
What kind of problems do you encounter?
Just everything. While we are focusing on basic care, and that's what most people come to us, it never fails that somebody comes in with a stomach ache, and before all is said and done, we've found out that the condition is something much worse. We've had patients we have seen all the way through first visit to getting them into chemo for a cancer that was found. So we see some really heartbreaking things. A lot of times it's just attending to those basic healthcare issues that so many people in our society now have. We have, a lot of hypertension, a lot of diabetes, just a lot of those kinds of issues that maintenance medication is the primary need, and getting to a doctor to get those prescriptions written is what we do, and then we provide them those medications on a monthly basis.
And we healthcare, we talk about that, but what people don't realize is that dental care is really important. If you don't take care of your teeth, it will then begin to affect your health, the rest of your body. So the dental clinic was instituted at what point?
Actually, we've had a dental program starting in 1995, right alongside of the medical. It was manned by volunteer dentists, much in the same way our medical clinic was. We had a unique opportunity about 4 years ago when Fairview Community Health was going to lose its dental program, and they approached CHC and talked to Connie Smith about whether or not we would be in a position to take over that dental practice. And that is exactly what happened. We moved their equipment, we had to do some construction. We took our very part-time dental clinic, a couple hours a week. I think in 2007 we saw 207 patients the whole year, into this full-time clinic with a staff dentist and hygienist and assistant. And we see a few over 2,000 patients a year now in our dental clinic. So it was a unique opportunity, and it has, we have really seen some amazing things come out of our dental clinic now. The dental clinic is what we call it, and we're having a great time watching those numbers climb a little bit every year.
Well, speaking of numbers, looking at your 2012 numbers for the Commonwealth Health Corporation's free clinic, over 2,400 medical encounters. That means 2,400 people came in, had encounters. 5,000 dental encounters is what your numbers show. Over 8,200 prescriptions filled, and this is really a big number, 1,700 plus volunteer hours, so people
Yes.
gave of those hours, and then $2.2 million in free services to the community, to those working uninsured.
Absolutely, and when I refer to an encounter and why my numbers didn't match there, encounters, sometimes we count the different things that we do. We might see one patient for a couple of different things, and sometimes that's an encounter. But in dental alone, it was over 2,000 individual patients that came in, and probably well over 1,000 to 1,500 individual medical patients that walk through the door. So it's a big number of people. It's, when you look at the individual services provided, it's astounding what we do with a very small staff, a very small amount of money, and a very generous community.
A very generous community. And so, like you say, and as we stated in the beginning, free clinics and community clinics now across the country, they have different names. Are they different and distinct, or are they basically providing free services?
You know, as being a part of the state and the national free clinic associations, free clinics take on many different forms. There are free clinics that only serve the homeless. There are free clinics that only serve non-residents. There are free clinics that just really put together different kinds of services.
Probably based on community needs.
Absolutely,
Yeah.
and you know, the difference in our clinic and something like Fairview, which is more of a federally qualified health clinic, is where the funding comes from, and the types of patients, whether they accept insurance, if there's billing. So there's a lot of differences in that, but free clinics just run the gamut of what they do, just dependent on the need in the community and how that community can support what that clinic's able to do with the monies raised.
We're talking today about the Commonwealth Health Corporation's free clinic in Bowling Green, which serves the South Central Kentucky area, the Barren River district, the Bowling Green, Warren County area, and the 9 contiguous counties. But What are some of the challenges you see, as we look at this huge healthcare reform initiative that's underway as we speak? Do you see that as a big challenge?
Just the uncertainty, I think, of what that's going to bring and what it's going to mean. And, we see the confusion. I think sometimes there are all these pieces of information out there for the taking. Sometimes our patients don't always have access to that, or
even the information.
Full
yeah.
So even being part of that, there are official navigators, that people that are assigned to help people make the transition with some of the new programs that are out there. But it's our job too, as we see patients. There are some of our patients who would love nothing more than to say, I can afford insurance for my families. Sure. I'm loving what I'm finding on the Connect website, and I'm going to try. That's what I want for my family. And other people don't understand it, and having a staff that's knowledgeable, corporation that's knowledgeable, so that we can help with that navigation process a little bit. Other challenges, clinical volunteers are always a place that we could use a little bit more bolstering in our numbers. We would love to have a few more doctors and nurse practitioners who could come and help us occasionally. Monies, that's always a challenge. We are very fortunate at the Free Clinic to have wonderful support from both. We have a foundation, the Commonwealth Health Foundation, who also raises money for the Free Clinic through fundraising events, and then of course our parent corporation, and then just private donors who really think what we do is the right thing to do, and they support us in that.
And if you're watching this program, we're going to put up a telephone number and a website where you can find out more information. Maybe you want to use the services of the Commonwealth Health Corporation's Free Clinic, or you want to donate, or you want to give some time, give some volunteer hours. Now, in addition to the Free Clinic, there's the Hospitality House, which I am intrigued with, and this is all part of the big umbrella? How does that work?
Yes. Now, Hospitality House, totally separate, different building from the Free Clinic. It is a department in which I work as well. Hospitality House is just 3 years old. In fact, we'll celebrate our 3rd anniversary in January. We opened January, I think, 27th, 2011. And the Hospitality House was built as a place to care for the caregivers. CHC firmly believes that patients that have a supportive structure as they recuperate tend to do better, or tend to react to having other people to help. And a lot of times caregivers don't take care of themselves when they're in the hospital taking care of patients that are sick. So the Hospitality House was built to provide a restful environment for those people to kind of rest and recharge their batteries overnight, either because they're taking care of a patient, or we also house patients who might be going through outpatient treatments themselves and have a difficulty with maybe the distance to their home or with transportation needs. And we also have, NICU families that stay with us. So
NICU, for those who might not know, what neonatal.
Yes. Moms who have had little babies, and mom's okay to leave the hospital, but that little baby's still in the hospital. And I don't care if your home is on the other side of Bowling Green. Sometimes that's too far away for a mom to be from the baby. So NICU families can come and stay with us as well. But primary goal was to provide a place for caregivers to come and just get a good night's sleep and head back to the hospital the next day and help take care and boost the spirits of that patient that's recovering.
And how does that work? Do you have to pay for it, or that it's totally free again?
There is no charge to stay at Hospitality House. We let our guests know that should they choose to make a donation, or if they feel that they could make a donation, we gratefully accept that, but there is no charge to stay at Hospitality House. That said, it's not only low-income families that are staying with us, it's just people who have a need. It could be a transportation need, it could be the acuity, that the health of that patient is so precarious, they don't want to stay across town in a hotel. They want to be close enough to run over if that need arises. So those people stay with us as well.
And speaking of those kinds of things, and you're lighting up this room with this information, but you light up the season, and it's a fundraiser. Talk a little bit about that.
Make the Season Bright is another one of the fundraisers that supports the Free Clinic. and the dental clinic being a part of the free clinic. We refer to it as free clinic, but that includes both of our programs. Make the Season Bright is a way that people who maybe don't have huge amounts of money to donate can do a lot with just a little. We have trees on each of our medical center campuses, both Bowling Green, Scottsville, and in Franklin. And we have individual events at each of those, but people can actually purchase a light in memory, in honor, or in celebration of another person's life, and we will light up a light based on that donation. There are $10, $25, $50, and $100 levels that you can make contributions in.
So it's attainable for most people to be able to do that.
Very much so. Yeah. And it's just a really neat event. We have 3 events. I think December 5th is our first one in Franklin, and then the next week on the 10th and the 12th we have our the first one in Scottsville, and then on the 12th is the big one here in Bowling Green in the auditoriums. And it's not too late if people still want to make a donation. They can drop that by the free clinic. They can also go to the foundation's website, and
we're going to put that
yes.
up there as well. And so just a lot of opportunities, and they can do it all year. They don't have to just do it at Christmas time.
We would love for them to do it all
They could do it all year. Carla Reagan, who is the Executive Director of the Commonwealth Health Corporation's Free Clinic and Dental Clinic, the Dental Clinic, located in Bowling Green but serving South Central Kentucky. And we've been talking about how Obamacare and Affordable Care will influence and affect free clinics, and it appears it's going to be a wait and see.
I think so. You know, when full implementation is done and out there and ready, we know that the ACA is not going to be a fix-all for everyone, and we're going to see who's left behind and if there's a way for us to fill that gap.
To fill in the gap, the free clinic. That's going to wrap it up for this week's edition of Kentucky Outlook. I'm Barbara Deeb. We're glad you joined us.